And good afternoon, ladies and gentlemen, and welcome to another edition of Futsal868 Corner Talks. My name is Geoffrey Edwards, series moderator and president of the Futsal Association of Trinidad Tobago. What a day in history as regards to the UEFA Champions League. Yes, we are 2 minutes late because of the UEFA Champions League. Futsal868 Corner Talks is an online meetup series where global sporting professionals share their perspectives on the fastest growing indoor sport in the world. But it's also where global sporting professionals meet. The rescheduled 2021 Summer Olympics, officially the games of the 32nd Olympiad, is scheduled to be held from the 23rd of July to the 8th of August 2020 in Tokyo. With this 2021, with this as our backdrop, Futsal868 Corner Talks will be hosting the four-part series entitled Jeux Olympiques. In today's sport world, most major events are designed around a binary concept with a focus on cisgender athletes. Transgender and intersex athletes, inclusion in sport is a very controversial subject to date. Instead of providing interested parties with unfettered sporting opportunities, it creates a challenging environment to which transgender or intersex athletes or participants need to overcome to achieve their sporting dreams. However, this debate over the inclusion of transgender athletes has been increasingly important among sport governing bodies, sport organizations, educational institutes, competitors, and most importantly, fans. Many international and national sporting governing bodies, including but not limited to the International Olympic Committee, IOC, US Boxing, International Tennis Federation, and British Rowing, have transgender policies. The policies vary among geographical locations and local law. Transgender athletes are now in the spotlight for inclusion, equality, and equity in and access to sport. Today, in episode 60, we discuss transgender and intersex athletes. Our guests are Dr. Joel Leach, medical doctor, Dr. Jax Heffers, veterinarian, and Mr. J. Tyrone Marcus, who will be joining us later as he's the president of the Trinidad Tobago Sport Association. Sorry, let me repeat that. He's the president of the Trinidad Tobago Association for Sport and Law, lecturer, and accomplished author. So we want to say thank you very much, gentlemen, for joining us on what is a very, very heated and debated topic. Thank you very much.
Thank you for having us, Jeffrey.
Hi, thanks for having us, Jeffrey.
So let's start with you, Dr. Leach, and before we do that, let's put up your presentation to help us understand some of the medical concepts as regards to this idea of gender versus sex, transgender versus intersex, which is very much mind-boggling for a lot of persons, to say the least. So let's take this time to put up the presentation for you. Are you seeing it, Dr. Leach?
Yes, I'm seeing it. Thank you. Thank you for having me today, everyone. So this afternoon, I'll be talking about transgender and intersex athletes. I'm taking from the perspective of the medical aspect. Now, certain terms have generally been heard in the media: disorder of sex development, difference of sex development, dysgenesis, gender identity, genital ambiguity, intersex, as we mentioned in our title, ovotestis, and sex of rearing. Next slide. So, first of all, we'll describe what we describe gender confirming surgery. Now, this is either transgender or gender reassignment surgery, as commonly known. This is where the actual external genitalia are surgically adjusted to resemble as well as to function as genitalia of the desired sex. Now, just for some history in terms of gender reassignment. Now, this has been recorded since ancient Egypt in 1500 BC. There's a Queen Hatshepsut who ascended to the throne wearing male clothing and a beard. And in ancient Rome, up to 220 AD, there was an emperor that actually sought the assistance of medical practitioners who could actually do gender reassignment surgery for him. Right. So this is the father of gender reassignment surgery. This is Magnus Hirschfeld. Now, in 1922, he actually had the first transgender woman undergo vaginoplasty. So this was actually creation of your vagina. There's actually a movie, The Danish Girl, which is actually based on some of his practices. Next slide. So in the USA, in terms of looking at all patients, whether athletes, the normal person walking down the street, there are over 1,000 gender reassignment surgeries annually performed in the USA. These are actually covered by Medicare, Medicaid in 9 states, as well as certain private insurance companies. So you have where we describe where biologically there's intersex. Now, this is a collection of diagnoses involving discordance among 3 processes. So that's your chromosomal, that is your actual genetics. You have your gonadal, which could best be described as your actual physical exterior genitalia, whether it be testes, whether it be scrotum, a penis, vagina. And then you have your phenotypic sex determination, which is, once again, those gonadal manifestations, as well as what you present yourself as to the public and to your family and to yourself. Next slide. Next slide. Right. So now you have also the chromosomal sex. This is essential at fertilization. So basically, this directs when you are conceived, as well as there's differentiation of during pregnancy. They are what they are called undifferentiated gonads. So we all start at one level, and then you either form testes or ovaries, as we would know when you have your typical either male or female, as we would commonly know, versus where we'd be discussing intersex, which would be a more complicated occurrence in this process. So you have your phenotypical sex. This is your differentiation of your internal ducts and what you call your external genitalia under the influence of different hormones and what we call transcription factors. Now, there's sexual differentiation. This is regulated by more than 50 different genes on both sex chromosomes. So that'll be both your X and Y and your other chromosomes. Next slide. So there is, when a newborn, you have what you call ambiguous genitalia. This is where there isn't a clear-cut male or female external genitalia. So this is a child is born, normal weight, could be preterm, which would be before the expected date, could be on time at term. And this is both a medical and psychosocial emergency. It's handled with great sensitivity. This is usually by neonatal doctors. Next slide. So when a child is born with these ambiguous genitalia, there is actually a host of different specialists that would be involved. There would be the pediatric urologist, an endocrinologist, psychiatrists, geneticists, pediatric doctors, surgery, as well as pediatric gynecology, and these work closely with the family. Now, this may be diagnosed prenatally, so in use of ultrasound during the pregnancy, we may have an idea that something is not entirely male or female with the birth process, or we may actually discover it as the child is actually born at that point in time. So you have to present to the parent, is this a boy, is this a girl? And at times you just cannot, and we have to go through an entire process to actually confirm this. Now, the precise diagnosis of the disorder is where this team is involved. It involves the parents, it involves to assign a proper sex of the child, as I mentioned in one of the earlier slides, rearing. So this is based on this diagnosis, whether it's a male, a girl, a female, or you need time to just decide what rearing of the gender of your child. that depend upon the status of the child's anatomy, as well as the functional potential of the genitalia and reproductive tract. Next slide. So the doctors initially go through the child's history. We can skip this one. This is just more some intricate details we would need. They document fetal testing. There's things like I described the ultrasound, that'll be a sonogram. You also have what you call karyotyping, which is looking at the basically genetics of the child. You look at the Otherwise, we look at the level of prematurity as well as maternal medications. These may have contributed to some of the abnormal development of the child in this case. Next slide. So you have, as I mentioned before, prenatally established expectations. These will involve to make the neonatal period much more. One second. Yeah, sorry for that break there. We have to emphasize the rule.
Doc, I think that you are muted a little bit. I think you're muted. I think we lost Doc. So before we continue and we get him online, I want our audience, both live and recorded, to understand that we want to take the time to get the medical experts to give us the necessary difference between transgender and intersex. And it's very important for us to be able to understand in layman's term through the specialist of a medical doctor what we are speaking to and speaking about. This is extremely important, and I am as well very much in thrilled to be able to have somebody as Dr. Leach be able to speak to us more to this and give us some more insight. It seems that we have lost Dr. Leach for the meantime. I hope that we can get him back. And for that, we'll just take the time to stop share his presentation for the sake that he will be able to get back to us. So with that being said, we jump straight on to Dr. Jackson. Dr. Jackson, please do tell us a little bit about yourself, as well as tell us your history when it comes to this idea of transgender, this concept of transgender, what has been happening in terms of the sporting world. And it's a great pleasure and an opportunity to be able to hear from you, sir. So talk to us.
Um, well, evening. I think the whole, I don't want to say like issue of transgender, but the whole transgender awareness has brought about new issues in sports, because now we have topics such as testosterone levels with cis women on the discussion. So I think it's a very fine topic, that you have to kind of walk a very fine line. Jeffrey, are you still there?
Yes, I am. Yes, I am. I just have you on full screen.
Okay, I was just double checking.
Yes.
Just double checking. But I think it's a very interesting topic, because also a lot of sports that, if you really want to look into it, don't actually separate by gender, because if you look at a main one is equestrian, right? So I ride horses. I've been riding horses my entire life. When we are in competition, it's just each person. It's you and your talents and how well you're able to communicate with the horse. Let me take these off. How well you're able to communicate with the horse, and how well you're able to do on each round. It's not females versus males in each round. It's based on a novice or intermediate. It's based on your skill level. That's how you're grouped, and that's how you compete. So I think we could basically adapt kind of like that, because we compete at different levels. So I think it's just most of the popular sports, if you really look at it, that are really segregated. So like soccer, basketball, track and field, most of the ones that you can monetize, to be honest, are what are separated. And even then, a lot of the women's sports, the athletes still outperform the men. Because if you look at the women's soccer team for the US, even some of the local clubs, or even locally, the women's teams will almost always outperform the men's, but they will get less opportunities and less publicity.
It's very interesting that you mentioned that the commercial side, because we definitely going to speak to the commercial side when Mr. Tabakus steps in. But I would like us to be able to get your journey as a transgender individual. Please do speak to us as regards to how was that journey before before, well, the entire journey, as a matter of fact. So the fact that you said I want to be able to transition and actually making the step to transition, how was that for you? Please tell us more to that.
My steps, I think, were a little interesting because I'm a little older than I look. And so I actually wanted to transition from as about maybe 17 or 18, but I honestly didn't quite, I think, have the confidence at the time to really pursue the hormone therapy aspect of that. And there's just a lot of, I guess, safety issues and concerns with transitioning. So for me, I started out in Jamaica. I went to an all girls high school and I ended up leaving after my first year of lower six. Because I was still too young for UE. So I finished at 15, 16. So I left and I went and did 2 years of boarding school in the States, which was also all girls, but it was so small that it was a very interesting opportunity. Initially, I was supposed to go to ride horses, but because of the seasons where I went, it actually allowed us to play different sports. So for that, I kind of took those 2 years to kind of get to know myself. Sorry. So it was like it was a very back and forth with myself because it was something that I kind of always knew. It was kind of like my best description would be when you put on a sweater that's too tight and you look in the mirror and no matter what you do and you try to adjust it, it just doesn't fit in the way that you want it to fit. That's kind of like how it is looking at your reflection. It's like no matter what you want to do, the person that you know that you are on inside, your personality, what you like, who you are. Not necessarily that, you know, if you're a lawyer, if you're this, like what was important to me was figuring out who I was, things I like outside of okay, a girl or a boy, what do I like? What foods do I like? You know, getting to know me as a person and then kind of figuring out, I guess, gender along the way. So I comb my hair different ways, I dressed differently. Kind of didn't really care what anybody else thought because at the end of the day, it's important to me how I feel about myself. Because, what always used to get me when I was little was if someone used to accuse me of lying. Because it used to get me more upset than anything else because I know I'm not a liar. So like, how dare you accuse me of lying? So that was important for me. So what got me was it's important that I know that I'm not lying. So move on. Doesn't make sense to be upset about something that I can't change. So it was a back and forth over, I guess, the years through undergrad, through my first degree and my master's. Eventually, I think about halfway through my undergrad, my first degree, I started to use Jackson.
So
Uh,
before you reached it, did you do
yeah,
your undergrad in the Caribbean or you did it in the US?
I was in the US. So I
Okay.
after A levels, I was in the US up until about 5 years ago. So
Okay.
I just returned to do my veterinary degree at UE because I wanted to. This was pre-transition, by the way. So I wanted to be able to practice veterinary medicine in the Caribbean. So I thought it would be best to come home and study at the Caribbean University. So I came to UE and I was about halfway through second year, and this is a 5 year degree. So I was about halfway through that when I just decided that I couldn't do it anymore, and so I had left. I had used Jackson in the US, but I had never really used it locally in Jamaica or in Trinidad. So it was about halfway through after I think my 27th birthday or something like that, 25th or 26th, something like that. I just couldn't take it anymore. So like I left one break and I came back with like significant weight loss, and my beard was starting to come in. Like my transition was a lot faster than what most had expected it to be.
And when you say faster, where first and foremost, where did you go to do the transition? You went back to the US, and when you say faster, explain what you mean by faster compared to others.
Well, also depending on the type of testosterone that you are administered. So the type that I get is in an oil, and it's meant for a long-term administration, and it's actually administered to cisgendered men that have low testosterone. So what the endocrinologist does with me is actually I found with an endo here locally while I'm in Trinidad, but I started my transition in Jamaica. That was like a really long process of having to go to a therapist and then a psychiatrist, and because in Jamaica they have to rule out mental disease, like you don't have another personality or anything like that, or this is actually who you are. So that's the process in Jamaica. So they support you, but they need to make sure that this is
You
what you want.
correct. So just to confirm, your medical procedure was done in Jamaica,
Yeah,
right? And you are now continuing that process in terms of the hormonal treatment here in Trinidad,
correct.
correct? Right. Let's talk a little bit as regards to, because I have let me just join, let me have Doc join. Thanks for joining us, Doc. Doc, just allow us, give us a little opportunity to talk some more to Dr. Jackson, and then we'll come back to you in terms of finishing up, just to be able to give us the whole idea of intersex and the medical concept of intersex. So just give us the opportunity for a little bit here. Um, and feel free, Dr. Joel, to be able to chime in if it is you have any questions as well. That's fine, because it's corner talks. We talking. We want to know. We want to learn and we grow at the same point in time. Um, Jackson, Jamaica. Jamaica is second home to me because I went to school at Mona campus, a proud urbanite, as a matter of fact. Um, but the culture of Jamaica is known not to be inclusive per se, right? I'm taking trying to choose my words very wisely. Is known not to be inclusive to per se. How was that experience for you in terms of the Jamaican culture outside of the medical fraternity, which obviously have to be professional, as well as your family?
Um, what I'm going to say is going to sound very controversial and very dangerous, but with regards to, I guess, Jamaican culture, they have a difference between, like, typical people in society have a difference between how they view homosexuality. So they will have homosexual, and then they will have Batima. So there's a difference. So it's mainly, I think there's still a stigma behind the more feminine as homosexual men, and I think towards the more masculine women, because it's still a very patriarchal society. So in regards to women that want to be viewed as men, okay, you want to be viewed as a man, all right, they're going to rough you up a bit. In regards to a man that wants to be viewed as a woman, if he wants to behave very flamboyant, they're less they they're less respectful towards that, as opposed to a more subdued homosexual, because they find the behavior outlandish, and
So
because
therefore, so therefore the transition, my apologies, so therefore the transition in terms of um, F to M compared to M to F, culturally, the acceptance is different.
yeah, and I think also it has a lot in terms of, I think, person's personality, which it shouldn't, because I think there's some people that they're just quieter, they're more shy, and so they might get by because they don't draw a lot of attention. Whereas someone that really wants to live in their truth, but they may not be able to look as feminine in the face, might draw some more negative attention. So I think it also really depends on where you go, and I think the age group of the population, because I think the newer generations are really more progressive in how they're thinking, because even when I've been out at the racetrack, there's been individuals that have been my age or a little bit younger than me, have said that they have friends that, you know, say that they don't really feel like girls, but they don't really understand what's going on. But it's after speaking with me that they understand a little better. And they try and include them in different ways, to try and make them feel comfortable. So, like that was really special for me. And that was like a particular memory that I hold, because it shows that Jamaica isn't as backwards as people think, and it's really just people need conversations, just to be able to have honest conversations with each other, where there is not a lot of anger and tension and animosity, because I think that's a big part of it. Because a lot of the time, yes, people are ignorant in how they ask their questions, but a lot of the time I think it's how people respond that makes matters worse. So like, someone may, just because of how someone was brought up, they may not necessarily think a question is offensive. Just like in some cultures, pointing is offensive, where in others it's not. But if you're not educated on that, you're not gonna know. So it's kind of the same thing. If there isn't discussions on topics that people don't know about, how are we ever gonna get any better? Because even before I got to transition, I didn't know what I was experiencing. I didn't know how I felt. It wasn't until, I got to meet other people like me when I was away at school, that, you know, I was able to, I'm not saying emulate them, but I took the time to get to know who I was and found my own bravery.
I want to say thank you very much for Jax. We are not finished with you yet. We're not finished with you yet. We started off with you, and we're going to end with you. So just give us a little time as we're going to speak to Dr. Leach, where I would like him to now speak as regards to intersex, the other half of the conversation, Dr. Leach. And I do apologize. I realize that you lost connection. So we're now going to just hop frog part of your presentation and speak more to, as I said before, intersex and that terminology called DSD. Tell us more from just freestyling about intersex, and what is the medical definition of intersex. What is intersex from in the medical fraternity? You're muted, Doc. You're muted.
Yes, sorry. So intersex basically it's in terms of your what you call you have your genes, and then there is a phenotypical difference. So there is not a strict male or female, and that is where in the presentation I had described we have from this is from birth. This patient is we have a meeting with parents, we have meeting with the other specialists as I mentioned before I got cut off there. And we try to assign a gender role to the infant, if we can at that point in time. So it'll involve, as I say, ultrasound. You have eventually, if would you be able to load up the presentation?
Yeah, most definitely, most definitely.
Yeah, could go to about yeah, about slide 22.
Okay, we're just gonna go back. Just tell me when to stop, Doc.
Mm-hmm. All right, you might have to go right, probably about here. Yeah, right, right. So we look basically at, you can go one slide ahead, forward.
Definitely.
Right. So we're looking at the what we call the neonatal period. That's where the child is just born. You have what you call your karyotype. So we look at 2 days in terms of looking at the actual genes that are present. We confirm the presence of what you call the second X chromosome. So this determines what type of hormones the body produces in terms of testosterone, which is your commonest one. We look at this chromosomal DNA data, so you have more rapid tests. Also, we would be able to see what your genes are and what you present with. Next slide. Right. So some of the investigations, we do some blood tests. We check the testosterone, as I mentioned. Next slide. And in examination, we will see there may be palpable testes on the child. You have the presence or absence of this testicular tissue. This should be documented, and we look at various hormones to assess what may be the expected, how to describe it, phenotype or external genitalia that may be present on the child, as well as the reproductive potential of the child. Next slide. Right. So based on this physical examination, the findings, as we said, the gonadal palpability, that's the testes, the presence of these will be Mullerian structures. That's basically, other words, basically describing if there's a ovary, which would be either externally or internally. We look at the genetics as we described. So you have the typical, you may have, in terms of your DST, some may be presenting phenotypically, that's physically, as undervirilized males. You have what you call overvirilized females. So you have a male or a female. You may have a female that may have extra presentation in terms of hair or beard or muscular development because of the hormonal abnormalities that would present this. So it's atypical to say you have a strict male or female, but you just somewhere in between to describe it as best. But you have to look at how you are reared. So you could possibly, if it's a female with these male characteristics, decide which side they want to rear themselves up. You may have where you have to tell your aunt, the public, the school, because it isn't their documentation may not be as fluid. You still have to say it may be a male child, you may have a female, and you may have to make some compromise there. And usually they decide later on if the options of surgical intervention or hormone intervention, as described by Jackson earlier on. Next slide. So this is just, so basically, as I mentioned here, you have, and if you look at the lowest parts of this flow chart here, you have male, female, then you have DSD, which is basically in between. And if you go to the next slide, yeah. So these are different, as a child, the child goes through different studies. We have what we call laparotomy or laparoscopy. That's basically investigations into the surgical investigations into the abdomen. We need to identify as well as take what you call a biopsy to see whether you have testes or ovaries there. Sometimes these organs may be hidden within the abdomen, and that's how the only way we could get a piece of that specimen. So you want to know exactly what is there. It is just sometimes ambiguous that you can't tell until you get this actual what you call histological diagnosis. We will decide if you need to remove what you call the gonads, so that's your testes or your ovaries. Sometimes, in example with the testes, if it's not outside the body in the scrotum and it actually develops in the abdomen, you have cases where you may have what we call testicular cancer may develop later in life. So these are some of the factors we have to look at also. Next slide. Right. So you have your, this is basically some of the other diagnostic maneuvers, as I mentioned before. I mentioned endoscopy, where we may have to look at some of the, where we're planning on if there's to be reconstruction of the external genitalia, whether it's the vagina we have otherwise, and we want to have a correct diagnosis that you actually have, because in urology we what you describe the urogenital. So uro would be the passage of urine versus your genitalia would be more your reproductive aspects of the human body. Next slide. Next slide. Again, you go ahead. So different tests, MRI, we may have to do in these younger patients. This might involve, it's costly. Sometimes we have to use general anesthesia. We may have to put the patient to sleep to do this test, because the patient needs to be absolutely still for this procedure. Next slide. All right. Yeah, as I mentioned before, you have risk of different cancers here, as I mentioned before. So that's why we have to decide according to the ovaries or the testes. You call these germ cell malignancies, and there are certain risk of them developing if you keep the organ there, if it's abnormally placed, or just because of the genetic abnormality could cause those conditions to arise. Next slide. So now is where we look at gender assignment. So this is where you have, after we've gone through all these tests, you want to present to the parents that what your child is presenting with here, we want to have your child as comfortable growing up as possible, as normal, and as we could have them. And that's where the parents have to understand you have high quality data regarding the long-term psychosocial outcomes of these gender assignments. For the majority of cases, it's lacking, but there are studies actually going ahead. Next slide.
It's interesting. Before we move on to the next slide, Doc, it's very interesting, and I want our audience to be able to understand this. The reason we are taking the time to go through this entire medical process as best as we can with the limited time that we have is for others to be able to appreciate the the amount of time that is taken before a parent even gets to make a decision. And we're going to speak to when it comes to organizations in sporting stakeholders who what is natural, that what is God given, now wants to tell you you cannot compete in sport when sport supposed to be for all. So I just want to take that time to be able to for persons to understand why we are going through this process.
And Jeffrey, when you, as you have mentioned that, so some of these, as I described, some of these conditions are very fluid. So you may have just a smaller appearing penis, you may have an enlarged clitoris, and a child, say in previous years, it may be so vague that no one would have even realized at the point in birth. So people, the parents might say, yeah, he's a little bit different, she's a little bit different. and they're raised as a boy, they're raised as a girl. And then when eventually they're an Olympic athlete, then you're finding out, oh wait, we have to do some genetic testing, but something just isn't right. So that is
Correct.
one of the most important factors for our description here.
So
So we have
I'm bringing in our sport lawyer, Dr. Marcus, Mr. Marcus. Sorry, I'm giving you a title, Mr. Marcus. I call you doctor. Probably that is speaking something into being soon. So I'm bringing you in, Mr. Marcus, because we are going to speak to the legal aspect of this soon enough. But it's just I want you to sit in with us as we go through this component of the DSD, because I know that you have in your book that you wrote when it comes to sport in the Caribbean, you mentioned, you spoke a lot about this, and it is. I would like to get your legal input, not too much because we're gonna have to speak to you directly, but your legal input to what is you're hearing, coming from Dr. Leach. So good evening, good afternoon, Mr. Marcus.
Hi, good evening. Thanks for having me. Good evening to your fellow panelists, Dr. Joel and Dr. Jackson.
Yes.
And let me mention, Jeffrey, that I dropped science in Form 3. I wanted to see the back of biology, chemistry, and physics as quickly as I could. So any doctor that you assign to me, it wouldn't have anything to do with science.
Well, the one thing I can say with this picture we have here right now is I could say Zim Boomba for this picture. So we have a geologist, we have a medical doctor, and we have a sport and a lawyer. So Zim Boomba, all saints, old boys. So we'll take the time to represent in a big way. So Dr. Leach, continue, sir.
right. So this chart here, you see, basically you have your gender assignment. So when we actually, that child has we have a definitive diagnosis. We went through the history, the examination, we did our investigations, ultrasound, MRI, genetic tests. The child could be, you have their older nomenclature, now they're newer nomenclature. So we sort of eliminated the names such as intersex, the hermaphrodite terms we've moved forward from them, and we have these more definitive tests such as names as your DSD. We have where we might describe the chromosomal 46XX DSD, and those as we go down the list here. So let's go. So all of as I say, these compared to your male and your female that you would be accustomed to, what we describe your phenotype, or you're rearing, he's raised as a boy, raised as a girl. These would be somewhere in between, and you basically have to figure out the sport bodies, they need to define where do we put persons who are in between. Is it a male that should be competing with females, or a female, someone that most resembles female, the strict female definition competing with males? So that is one of your controversies, right?
So Doc, I'm gonna ask you a question up front. Is it easier, given the fact that the nomenclature is increasing from the last time I would have visited this topic in 2019? Is it easier to be able to define medically a transgender athlete, and I use an athlete in terms of recreational and competitive, versus athlete, an intersex athlete, as is described there? Is it easier from a medical standpoint?
For intersex, for sure, we have our definitions and we can stick to that. But it's a matter of what different sporting bodies may decide what they would say as male, female, or what they just have no gender, or everyone competes in their sport. So that is where you would have your issues. You're looking at whether it's a world record holder of the time, what the time is, and what your definition
All right.
of.
Don't go too much yet into Mr.
Yeah.
Mr. Marcus. Mr. Marcus,
So
well,
you guys just
he
yeah.
hold on nicely.
Yeah.
Right.
Yeah,
So
that's his job. Yeah.
yeah. So we're moving on
I have
to
the easier part of it. Yeah,
yeah, the
yeah.
easier part of it. So the parental involvement in the decision making process is essential, as you rightfully said.
Right. So this
Mr.
is the
Marcus,
intersection. This is from
yeah. And then we
Yes.
talking about you're talking about the diagnosis of a DST is made um, prenatally, correct?
yeah, that is possible, or after the child is born. So that could also be done postnatally.
Okay.
Next slide, yeah.
So, Doc, I see that the rest of the presentation is speaking more to the whole concept of DST. Is it
Yeah,
possible
and I don't think we need to. We could, yeah, you can go skip
for
some
the
slides
sake of
because I'll
time?
tell
So, I
you.
want to say thank you very much, Doc, for giving us this medical briefing, as I may say, to who we are. You know, the biology, as Mr. Marcus say, we give up that since Form 3, Form 4. So I want to say thank you very much, Dr. Leach, for taking the time for helping us understand a little more from the medical side the difference between intersex and transgender. And I know that you are an extremely busy person. We pray for God's richest blessings to you and your family, especially during this pandemic time. And thank you for serving us. Thank you very much for serving us and helping us be a better nation. Be
Much
safe
appreciated.
and see you soon. Thanks very much, Dr. Leach.
Okay, thanks.
So that was Dr. Joel Leach, who spoke to us as regards the medical side of this question of intersex and transgender. And here with me is Mr. J. Tyrone Marcus, President of the Trinidad Tobago Association for Sport and Law, lecturer, and I'm going to add accomplished author. Thank you very much, Mr. Marcus, for joining us here on this topic, this what is considered controversial topic. We witnessed this year for the 32nd Olympiad, a transgender athlete being accepted into the Olympic movement, into the senior Olympic movement. From a sports law standpoint, please speak to us. What does that mean? And I want you to also introduce the legal principles, including equality, proportionality, and personality rights to our viewers when we bring this together.
Geoffrey, again, thanks for the invitation. And this is quite an opportune, very timely conversation we're having. As you would have indicated, those who have been looking closely at the build-up to the Olympic Games would have noticed the acceptance of the New Zealand weightlifter Laurel Hubbard to take part in the Olympics in Tokyo in a couple of weeks' time. And as you would have introduced, it is controversial because it brings the question of fair competition. So what has happened in Florida, for instance, is that the state of Florida, effective the 1st of July, so very recently, would have introduced legislation called the Fairness in Women's Sport Act. Now, why would they introduce legislation like that? Florida's view is this. If you are competing using a sex or gender that is different from what is on your birth certificate, then we're not allowing it. And from the perspective of fair competition for female sports, they are saying if on your birth certificate you were registered as male at birth, but you have done a gender reassignment and you want to compete as a female, the state of Florida has said we're not having it. And their position, Geoffrey, is that to allow someone who was born male to take part as female, it now breaches this principle of fair competition. So that opens up quite a number of, I think, layers of discussion, because in addition to the transgender issue and the gender reassignment issue, it falls squarely within the cases coming out of the Court of Arbitration for Sport involving the Indian sprinter Duty Chand and South African runner Caster Semenya. So I guess I would say at the starting, the initial discussion from a legal perspective is, what is fair competition? How do you preserve this classification of male sport and female sport? And it's very complex.
Indeed, it is extremely complex. And with that being said, I want to take the time, Mr. Marcus, to let's go through the timeline of regulations when it comes to sporting, international sporting federations. Yes, let's take the time to go through that. As we're seeing here, in terms of the regulations timeline, in 1960 we had the physical inspection. In 1968 we had chromosome testing phase. Then we had a gap. And then from 2000 to 2019, 2000 we had the beginning of the hormone testing. Then we had the IOC guidelines on sex reassignment in sport. 2011 we had the IAAF sex reassignment. Then 2016 we had IOC guidelines, and then 2019 we had IAAF again. But with that being said, Mr. Marcus, it seems that it is only the IOC and the IAAF who have been speaking to these guidelines or creating guidelines that athletes can deal with. Where does the sport law fit into this whole concept of regulations, as was clearly put out in Miami?
Yeah, thanks again, and I appreciate the timelines and your observation. A focus on track and field in particular, and even within the broader Olympic conversation, track and field continues to be what stands out. And that raises some interesting questions, because coming out of the Semenya Award, where the Court of Arbitration for Sport ruled against Caster Semenya, they ruled in favor of the IAAF, saying that the DSD regulations that replaced the hyperandrogenism regulations, which were introduced with Duty Chand back in that 2014 period, the Court of Arbitration for Sport said, these rules, these DSD regulations, they are discriminatory on the grounds of sex. However, although they are discriminatory, they are necessary, reasonable, and proportionate. However, they still express concerns as to why the IAAF included races like the 1500 meters and the 1 mile. They said, now, based on the science that the IAAF has brought before us, now, because the IAAF fell down scientifically with Duty Chand, Duty Chand was able to say, no, the science doesn't prove that the testosterone is this primary factor that gives 46 XY DSD athletes the significant performance advantage. At least that came up in particular in Semenya. So the Court of Arbitration for Sport said, I can understand why you apply the regulations for the 400 meters and for the 800 meters. I don't understand why you apply it to the 1500 meters and the 1 mile. So that goes back to your question, Geoffrey. If the Court of Arbitration for Sport already had question marks about 2 of the races in track and field, I wonder what would be the reality for other sports. Now, we don't have the benefit, because I am only aware that a challenge was brought to a golfing association where transgender regulations were concerned. But outside of golf, I am not aware of any other sport where the issue has come up. So whether, and let me say this, the Court of Arbitration for Sport made the point very, very clear. This discussion is a lot more about biology than law.
You know, it's very interesting you mentioned that, and you spoke to international federations, sporting federations, because based on the final group project that was done in 2019, but presented in 2019 for the International Sport Management Masters, called the FIFA Master. It was found that these five, listen to this well, these five international sporting organizations, or we know them as sporting federations, are the only five federations as of 2019 that has regulations that speaks to intersex and transgender athletes. Interestingly enough, yeah? And what was the main findings in the report was, one, there was a conflation of intersex and transgender. Many of them didn't even understand the difference in terminologies. There was no standardization of terms, and there was a lack of knowledge. Yeah, Mr. Marcus, with that being said, Caster Semenya has been told she can't run athletics, but yet we have a weightlifter who has said, yes, you can come and lift. And now, where sport is supposed to be meant for all, where does the legal side speak to that? Do you think that the Caster Semenya case may be reopened? Do you think that we are still, towing the line on a legal standpoint? And I totally agree with you. This is not about law per se. Law just happens to be dragged into it, but it's more for the medical experts. But let's talk some law with you here. Do you think that Caster Semenya case will come up again? Do you think it was unfair and unjust, I'm using the word, to be able to speak to transgender and not necessarily to give Caster a chance, sir?
Thanks for the question. The Semenya fallout is far from over as far as I'm concerned, especially in light of the fact that she currently has appealed to the European Court of Human Rights. My own colleagues within the profession believe this may very well be her best at the Court of Arbitration for Sport. She was able to appeal to the highest court in Switzerland. Swiss Federal Tribunal. She lost there as well. So now she's going to the European Court of Human Rights. And I think just the very nature of the mandate of a court like that, I think is going to give her, greater opportunities to be victorious, because the Court of Arbitration for Sport felt a little bit hamstrung because of how dependent they were on the science. Because the question for them, they said to Semenya, we are not challenging the fact that you were born female, that you identify yourself as female, or that you are legally recognized as female. So that's not the issue before us. But based on the evidence that the IAAF has brought, of course now rebranded as World Athletics, they had to agree with the IAAF and say, based on your levels of testosterone, you are biologically male. And what it means, there's a reason why we have separated male and female sport. Those classifications have to remain separate and apart. If we allow you to run with your natural levels of testosterone, it's as if women were competing against men, which is not fair. So it really was a lot about the science. And Semenya says human rights breach of the IAAF constitution, breach of the laws of Monaco, etc. So to answer your question, I think it's far from over. And the weightlifting situation with the New Zealand weightlifter, that is going to open up just a whole other level of discussions. I mean, you already have had athletes write to the IAAF, suspend these regulations that you mentioned in your slides from 2015. Said we're not convinced enough scientific work. All right. Now let me just mention this as well, Jeffrey, before we move on. To be able to compete as a transgender athlete in the Olympics, the key criterion is this: show us that for the past 12 months, your testosterone levels have been below 10 nanomoles per liter. If you can show us that, you're eligible. And the athletes who are opposing it are saying, but is that enough? Is that the only yardstick that you will use? You know, what about all of the post-puberty physiological development that would have happened? And the bone structure, muscle mass, etc. Those other things, all right, the weightlifter still carries over from her male past. So they're questioning this issue of just looking at the testosterone levels. So in short, Jeffrey, I think this is far from over.
In doing research for the paper as well, it was highlighted that DSD, the aspect of DSD, we'll bring you in, Dr. Jackson. The concept of DSD, intersex athletes or intersex persons, actually, medical research shows that it's prevalent in latitudes, in tropical latitudes, yeah, compared to temperate countries, i.e., a lot more non-whites have intersex compared to whites. And with that being said, some persons are even arguing, is this another way to profile athletes and keep them, minimize their impact on the world stage? For instance, Caster Semenya was dominating the field, and many persons did not appreciate and like that in some quarters. It has been said. But let's speak as regards the principles of sport. The principles of sport speaks to inclusion, equality, equity, and fairness. How does those four principles of sport affect the Caribbean athletes who, and I want to draw it home to us here, the Caribbean athlete who may be challenging national sporting organizations and international sporting federations, Mr. Marcus? That also points to part two of that question. Do we in the Caribbean have regulations to assist with the discussion of transgender and intersex athletes?
It's a great question, Jeffrey. And, I guess one of the things that happens a lot, both in life and in the legal profession, is that it's only when it warrants. It's the reason why you have laws always being amended. Legislative drafters would draft legislation thinking that they've covered all of the bases. Then a situation comes up which they didn't anticipate, and then you amend, you repeal, you introduce new legislation. And I think similarly, because this idea of transgender, intersex, DSD, etc., as far as I'm aware, hasn't really been brought to the fore in Caribbean sport. I just don't know if those regulations are in place. What it quite, um, I think, appropriate that you would have started off today's discussion with experts in the medical field. I think it's going to be minds like these coming together with your own skill set, Jeffrey, and sports administration and sports education, with the medical experts, with the legal professionals coming to the table. There's an opportunity for us to be proactive and to actually start thinking when this issue reaches our shores, we're not caught off guard. But again, I'm not aware that this particular issue has been raised in terms of actually dealing with an athlete, all right, from a transgender, intersex, or anyone whose levels of testosterone have been questioned in terms of whether they're biologically male or female. Testosterone levels have only arisen in the context of anti-doping.
Let's bring in Dr. Jackson into the conversation. Dr. Jackson, Mr. Marcus would have made a point and you said it's a little bit iffy. But you know what's really interesting part about it is that you are a Christian. Yes. And it was so happened that in 2019 I visited FEI, which is the world governing body for equestrian. And when our group spoke to transgender and intersex athletes, they were like, well, that doesn't affect us because the main athlete is, well, sorry, let me rephrase that. The main athletes are the horses, not the riders.
Exactly.
They don't care what the sexy riders are, right? You know, that's interesting, Mr. Marcus, right?
Exactly.
It's one of the only sports in terms of that is represented internationally that really don't have to answer this question as regards intersex and transgender athletes. But to you, Dr. Jackson, what are your thoughts as regards to the Olympic or the soon to be Olympian in weightlifting? Do you think it is fair? Do you think that person should be a part of the Olympic movement, the Olympic Games, the experience to be able to type OLY after their name in a year or two?
I think that once your levels are under 11, that you should be good to go. I think it's difficult to kind of speak to these experiences when you haven't personally gone through. I think, having taken either hormone, so it's kind of hard to know what each person is experiencing. And also because each person is a genetic individual, each person is going to react differently. So, everyone will kind of have their own different changes. There's no algorithm to kind of say that this change is going to happen in this person because this one happened in that person. It's kind of the same thing with male pattern baldness. It all has to go with your genetics. So your genetics will only allow for as much phenotypic expression as possible. That's why, I made the comment earlier that my transition was a little faster because it just happens that my body likes testosterone. So within the first shot, which isn't really supposed to do anything, my body was like, weight loss, all the, I guess what you would have called baby weight that I would have been trying to lose like all the years, like little pudge. Finally, I woke up, I had abs, there was.
I need to get a shot like that. Dr. Marcus, what are you doing wrong?
So I had a full beard within 3.5 months, 3.5, 4 months, and I was only 2 shots in.
Right.
So everybody reacts differently because there's people that have been on testosterone for 2 years and they will never grow a beard, or they don't get a beard until like 4 years in. So everyone kind of reacts the same. sorry, reacts differently. There's no same reaction with the treatments. So it's kind of hard to say, how each person's going to change. And your bone structure does change a lot because even though, if you notice, like I'm still kind of clicking my jaw a bit, your face structure, like my face was very quite round before, but as I get further into my transition, it's a lot slower than the beard came in, but my jaw structure is coming in a lot more angular. So, and as well as my bone density. I had actually fallen off of my horse before I started the hormones, and I had some difficulty with the bone healing and some nerves. And it wasn't until after it's not until kind of like now, and I'm hitting 3 years into my transition, that my body is kind of trying to heal itself now. So this for me, like now, this is like my body settling to what's supposed to be normal for it. So it's not necessarily, like, yes, it is a transition, but all the times that I would have not necessarily identified as female, but existing in a female body pre testosterone, I didn't quite feel right. Like, when you eat something and your stomach just always feels upset. I always felt off.
Mhm.
So it's like now not the more, but the further along I get, because it's not that I'm getting more shots, because actually the further I get into my transition, I'm realizing the less I have to take each year because my interval gets spaced out and my bone structure is getting a little heavier. So while I might be a little thinner in terms of like less fat, my bones are getting denser. And it's not a transition that's like Kool-Aid. So it happens in like a year and a half to it's like 3 years, 4 years, 5 years. It's a process, and you don't really kind of know what you're gonna end up with. So each person is kind of the same. So I think once it's under 11, because that's what they identify as Superman levels, and I've accidentally hit that level before because we were trying to figure out which interval was best for me, and I got my shot what would have been too early, and I can tell you the difference between now where I can tell my levels are a little lower and between when my levels are 11 and like 10, like there's a difference. I'm pretty much like Hulk, where I want to lift everything, I want to do everything. Like, you know, it's pretty much like, you want me to go through the wall? Okay, Kool-Aid man, all right, let's go. You know, so that's the kind of mindset, that you have
Yeah.
when all that testosterone is running through. It's a different, your brain literally thinks different, and everything, your entire body works differently than when you have the estrogen compete higher. So
Yeah.
that's why I could understand with the South African case where they're coming from and where they're going with the the levels for our weightlifter. So I can understand where they're coming from.
Mr. Marcus, I'm watching you while I'm listening to Jackson sometimes, and I'm seeing your facial expression. Tell us what's going through your legal mind as you hear Dr. Jackson speak. But also, have you, if you were to represent a transgender athlete legally in the court for in front of CAF, in front of the courts in the jurisdiction of Trinidad and Tobago, and hearing Dr. Jackson's experience, what is going through your mind?
Yeah, it's I think someone had made the comment online a little while ago that it is so complex. it's so multifaceted and so multi-layered. And I know for me, whether I were representing the athlete or the organization, so much, I'd have to be very meticulous in my preparation. So, for instance, maybe you were reading my mind, Geoffrey, when Jackson was speaking, because I actually wanted to pose a question to him as he was able to talk about the 11 threshold. Jackson, to what is this Supreme Court of Sport really in Switzerland that we call CAS. And one of them involved a sprinter from in 14, and another one involved a 400 and 800 meter runner from South Africa in 2018, 2019. '14 and 2018, the IAAF dropped the threshold from 10 nanomoles per liter to 5 nanomoles per liter. And that, because I'm coming from a non-scientific background, I couldn't understand why the threshold to be in the male range was 10, and then it was lower to 5. And then I would hear you today mention 11. How could that kind of change of threshold happen from a biological perspective? If Geoffrey, through you, I'm able to ask Jackson that question.
Of course. We have it's corner talks. We talking. I mean, oh, by the way, guys, it is 1:20 that we are on. So by if you all could allow us some extra time here, just as the Euros went into extra time and penalty kicks, I wouldn't mind some extra time. So, Mr. Marcus, let me know if that's okay with you. Dr. Jackson, let me know if that's okay with you. Thank you very much, gentlemen. So, yeah, that's all by fine. Dr. Jackson, question to you, sir.
Well, for me, when my levels got too high, we just kind of waited for them to level out. And so what we did was we skipped a shot. So I don't want to say normal, but I guess typical transgender F to M, when they start the testosterone that I'm on, they typically get every 3 to 3.5 months. Some people will require estrogen blockers, because even though they're getting it that frequently, their levels will not get high enough to elicit a change. So their estrogen will still be too high. And so they'll have to take estrogen blockers. Now, normally, the body will regulate testosterone in terms of changing it back to estrogen. So if you kind of notice those super bodybuilders that take a lot of testosterone, their BB is very small, because their body is now producing more estrogen, because that testosterone has to get converted to be eliminated from the body. So it's eliminated to estrogen. So that's how you get gynecomastia and cis men developing male boobs. So you have an excess of testosterone, which then gets converted to estrogen. So that's why when you're doing the transition, you have to be very careful with your balancing of the hormones, because you want enough testosterone that you're able to change from female to male physically, but you don't want too much testosterone that you're now giving yourself back estrogen. So it's about finding that balance. Some people have to go on estrogen blockers to catch that balance. Some people will have to take less testosterone. So they're those. So like I get 4 cc's, so 4 milliliters, not a full syringe, and some people get less, like 3, you know, 1. It really depends. And so they will get that, and they'll be on blockers, and they'll be on a shorter period of time, whereas other people don't. So like in my case, my interval is 6 months, because my body, it just, I don't know what it does with it, but it just keeps the testosterone. So my levels will spike to maybe about like 8 or so, I guess, now highest, and then they stay around like 5, and then the lowest it ever drops is maybe like 3, and that's like around like 5.5, 6 months. So I mean, it works out for me in my favor, but usually you just kind of have to wait for them to taper off. So you have different types of testosterone. I can't remember the other type. I think it's a cypionate. I don't really want to get too medical, but it has to be. It has to do with the type of carrier that it's in. That it's in. So I get one that's in something really oily, so it hurts like hell to get it. The other types not as oily and are a little easier if you want to give to yourself. Those are not. They have a shorter half life. So you kind of have to get them a little bit more frequently. And again, if you're to switch from one type to another, your body then has to get adjusted to that again, because it will go up and down. So you'll have dips and you'll have peaks. So I take the testosterone that I take so that it doesn't dip drastically, because well, I'm not sure if you ever had low testosterone, but like with men, when they have really low testosterone, they feel very fatigued. So to eliminate that, I get the type of testosterone I get so that it doesn't drop as quickly.
So let's take a comment from Facebook that says, and it's from Ray F. Das. It says, I take the point of the limited testosterone levels being a sufficient marker in distinguishing male and female. However, how should post-pubescent males who transition to females be treated? Athletes usually train in their particular sport from youth. Therefore, in the example of the weightlifter, she would have been lifting as a male and would have developed muscle mass, and bone density greater than what the female athlete training at that same time would have had. How many, and I just have to continue to read it from here. How do SGBs therefore move forward? I'm guessing that she mean that person, he or she means sport governing bodies. Mr. Marcus, you want to take that question?
Yes, and I happen to know that particular person. She's an attorney at law who's currently doing a master's degree in sports law,
Thank
which
you
is
very
why.
much.
Yes, that's Miss Ramdas, and
Thank you very much, Mr. Ramdas.
yes, and I appreciate the question. So she raises the point when we go back to Laura Hubbard, the New Zealand weightlifter. The New Zealand weightlifter was competing as a male weightlifter. I believe it's either up until 2013 or 2015. All right, and now has transitioned and has met the criterion I mentioned earlier of a 12-month period of the testosterone levels being lower than 10 nanomoles per liter. So maybe Jackson might be able to help out a little bit here, because Ms. Ramdas's point and question is similar to something I was raising earlier. Now, in the Semenya and the duty chant cases, the medical experts all seem to agree with this. Even though testosterone is not the only factor affecting performance, they said it was the primary factor that could give a significant or substantial performance advantage, all right, to the person with higher levels of testosterone. So, Jackson, one, I'd love to get your confirmation on that from a sporting perspective, testosterone might be the primary factor. Yeah. But then, as Ms. Ramdas was saying, wouldn't Ms. Hubbard have an advantage because having competed as a male up to either let's say 5 to 7 years ago, doesn't she still have the advantage of male muscle mass, male bone density, those types of things that transitioning to having lower testosterone levels doesn't reduce the muscle mass. So she still has those male advantages. I'm thinking that Ms. Ramdas is making a good point. So maybe again, Jackson might be able to chime in on that.
That's why that's why I was kind of laughing and saying that's iffy. Because if I were to show you a picture of what I looked like a couple years ago, you wouldn't think it was me, because it looks like a completely different person, because my bone density has changed, my face structure has completely changed, as well as my muscle mass. So, and that is in regards to the testosterone changes. But I would agree in terms of testosterone being, um, giving an advantage, because it definitely does. It definitely helps increase, your muscle mass, and pretty much puts you at, your athletic peak. It enables you to kind of get the most out of your body. So I would agree in terms of having higher testosterone levels puts you at an advantage in any category, whether if it's male or female. In terms of the transition, I think, the only way we're gonna get more people to understand the changes that come about are for more people to have open discussions about it, about, their personal journeys, and, what it's been like for them to transition. Because, people are just going to assume that, okay, because this is what you are training as before, that bam, this is just it now. It's just you have whatever hormones different. No, like, your hormones have physiological properties, like they do things. So it's not just existing in your body, for a reproductive purpose. They have physiological importance. So there's different things, like bone density changes, whether your hair gets thicker, vocal cord thickening, things like that. Your vocal cords is not going to thicken overnight. Your voice is going to take time to deep. It's just like, think back to how you went through puberty. It You didn't just get your deep voice overnight. You didn't get one growth spurt. Your growing took time. It took time for you to develop into your man body. Even as you went through teenager and young adulthood, the body that you have now is not the body that you had then. And it's the same thing with women. A lot of women get osteoporosis. Their bone density will continuously change throughout life. That's why, as with pediatricians, that is part of normal childhood development. They measure the size of your skull. I don't know if you'd remember that when you go to the pediatrician. They measure your skull, they measure your arms, your legs. They try and, they measure your growth, because you're supposed to have a growth rate in proportion here. So for you, your legs are supposed to be within a specific proportion to your torso. So it's not to say that this person is short or whatever, or, you kind of go as an individual. So I think it's just for more conversations that need to be had to open, I guess, the I don't want to say open the education level, but it's I know that this may seem like private topics, but the fact of the matter is, if we want to be included in what's, I guess, public spaces, or, the greater aspect of society, we have to break down walls and be visible and be vulnerable and be willing to answer questions and give, I guess, the truth. Because a lot of people just have assumptions based on what they see on TV, or based on just what they read on the internet. And the fact of the matter is, most transgender individuals have been, I guess, living, I don't want to say in secrecy, but have just been living their truth, but have not been out about it simply because of how society has historically been. So it's not until recently that, the newer generations have been able to say, all right, this is me, this is why I'm, take it or leave it. And, insurance covering surgeries, these are recent things. So I think it's just, um, I guess, the gateway to the future, to the point where this may become, I don't say it'll be the norm and there'll be less discussions on it, but there'll be more understanding.
I want to say thank you very much for giving us this opportunity to have a gateway to the future, because everything happens in God's timing. To be able to get you, Jackson, the process that got you here. Literally, this for us this evening was just going to be me discussing the paper with some of my former colleagues. And then during the week, I spoke to a great friend of mine, and then it transformed from just having discussions in the paper to be able to have you and then Mr. Marcus. And as I said before, everything happens in its own, in God's timing, because Mr. Marcus is normally busy, and I know Sunday is a family time for him. So for him to be able to be here and spend this extra time with us, I know is a blessing. And then on top of that, Mr. Marcus would have shared with me, to listen on during the weekend as regards to a program that he's having on church, as well as he's also teaching open campus as regards to this particular topic. So everything just fell into place, and I'm very much happy. With that being said, we are going to continue the conversation on our IG Live on Wednesday, and we're also going to have a Twitter space on said. So because we know that time is very valuable, and it is Sunday evening, and we want to be able to people to spend time with their family and their loved ones. So we want to be able to be mindful of that. So we're going to close the show as regards to speaking to recommendations to national sporting organizations, national governing bodies, and international federations. And just for the sake of time, again, I will just share with you guys, and also the audience, what it is we would have come up with in terms of the group when it came at our final project, when it came to recommendations. And it went as follows: establishment of a steering committee, for which I recognize that Mr. Marcus would have spoken to, and we would have recognized such, whereby there was a clear divide between the legal fraternity and the medical fraternity. And there needs to be a steering committee from the community-based level to the governmental level to the regional level and also the international level. Stakeholder education program, for which we consider ourselves doing this topic, is one of them. Establishment of an independent medical body, creation of a global database, mandatory competition specific regulations by international sporting federations. And I will add to that national governing bodies and national sporting organizations, just as there are safeguarding children in sport policies. We also believe that there should be policies as regards to transgender and intersex. Methodology to prevent sex doping, because as you will hear from Dr. Jackson, if it is you do that in terms of putting testosterone into your body, even as a male, you can be able to increase your competitive advantage. And then lastly, one of the following division of categories based on self-declared gender with no consumption of exogenous substances, athlete sex determined solely by testosterone, and female sex category only. These are some of the suggestions that we would have made, Dr. Jackson and Mr. Marcus. I definitely would like you to speak more to these suggestions. And if you by any means you could take away. The floor is your guys owns.
I'll just jump in here, Geoffrey, by saying I think these recommendations are quite pointed, quite relevant, and broad-based. And I think especially recommendations 1 and 2 really speaks to what Jackson was mentioning a little while ago. So much of decision-making in and out of sport is often done emotionally, but in the absence of research and education and proper discussion. And so I want to endorse his own philosophy of let's communicate, let's bring together. And this is what recommendation number 1 talks about. I mean, a colleague of mine, a Trinidadian colleague of mine in Anguilla, we share this philosophy, and we say that none of us is as smart as all of us. A saying I heard first from Clem Blanchard. And so I think the idea of bringing together all of us, the stakeholders, as Ms. Ramdas mentioned, the sports governing bodies, the educators, science, law, administrators. So, and I think that really becomes a catalyst for the other recommendations to come into place. And I think as well too, us being willing to accept the complexity of a topic like this. We can't be simplistic about it, and we can't be impatient either. So that's the only other thing I would want to say, Jeffrey and Jackson, as we think about adopting some of these recommendations. Let's make sure that we have the endurance to run a marathon, and I'm not saying that it's a sprint, because I think if we're willing to stick with it, then these are issues that are going to benefit not just the sporting fraternity. These are societal issues. These are sociocultural issues. These are identity issues. These are issues that affect people's confidence and identity. So it's broader than just sport. And so, Jeffrey, thanks for the initiative. I think the way that things just evolved for today's discussion to happen, like you said, I think it was divine guidance. So again, thanks for the invitation to be here.
It's always a pleasure, Mr. Marcus. And more so, coming from the Caribbean, Jamaica boasts of having the most amount of churches per capita in the world. And from a Caribbean culture, religion is very important. And the reason I'm bringing up religion into this conversation, even though my father always says, keep religion, sport, and politics out of your conversation. But here it is, we speak in sport. Sport is a reflection of society. And more so when it comes to religion, it has been a taboo for years. And Mr. Marcus, you said it well. It is going to wash up on our shores, and it is going to affect us in some way or the other. And it's very important that we have these difficult conversations. Some may deem it difficult, and others may deem it important. We here at Futsal 868 definitely deem it as very important, being a sports stakeholder. Jackson, please tell us, what are your thoughts, the recommendations that we propose in 2019?
No, I definitely agree. I think they're very pointed and specific. But I think it actually allows for what you would call fair competition, especially the methodology to prevent sex doping, because I think one of the biggest issues is that people will try to self-administer black market testosterone in the event to try and give themselves a leg up, and because they will try to kind of manipulate their levels, they're gonna end up doing more harm to themselves. So I think they're very good recommendations.
So, gentlemen, I want to say thank you very much. And to our viewers, those who are watching us live and recorded, please note that we would be having our Twitter space and also our Instagram live in continuation of this topic, intersex and transgender and intersex athletes, because it's a topic that I didn't expect it to go the way it went, but thank God for his mercies. And check us out on our social media pages, Instagram, Facebook, Twitter, YouTube, and at Futsal 868, whereby you'll be able to get the dates and the times as regards to our continued discussion on this topic. To you, Mr. Marcus, to you, Dr. Jackson, to Dr. Joel Leach, who started us off as regards to medical definitions. We want to say thank you very much. May God continue to richly bless each one of you and your families during these pandemic times. We see that the country is reopening, but still, we ask that you continue to be safe. So until we see each other again and we talk to each other soon, we ask you all to be safe and continue to walk in God's path.
Thank you. Same to you.
Yes, thank you. Same to you.
All right. Bye-bye. Cheers. Have a good one, guys.
Same to you. Bye.
So that, guys, it is an hour and 45 minutes of sheer brilliant conversation, to say the least. I'm truly blessed and honored to have been a part of this great initiative. Noting that next week we are going to continue the Jeux Olympiques, our four-part series that speaks to the Olympic movement and all topics that deals with it. Next week we are going to discuss law and the games, where we have with us Dr. Emma Pirou, lecturer at the Faculty of Law, University of West Indies, St. Augustine, and Dr. Justin Koo, Deputy Dean of the Faculty of Law, also of the University of West Indies, St. Augustine. So check us out. We are back at our regularly scheduled time, 4 p.m., and we really hope to see you all next week. And again, as I said before, please stay tuned to our social media pages, where we continue discussion as regards to transgender and intersex athletes, in terms of our Instagram live and also a Twitter space. So until then, we see you all next week. Be blessed, be safe, and have a great one. Bye.